pledge of allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, before getting into our agenda, I just want to take a second to congratulate the girls track team, the Division III State Relay Championship, I think for the first time in the school program. Head coach is Jessica McCarthy, so congratulations to Jessica and all the girls who participated in that endeavor. Next item on our agenda is the approval of the minutes. We've got several meetings to approve here tonight. The first one is August 17th, 2021. Is there a motion?
So moved.
Second.
Moved and seconded to approve the minutes of August 17th, 2021. All in favor?
Aye.
Opposed? That passes unanimously. Is there a motion to approve the minutes of the meeting of January 11th, 2022?
I'd like to move to approve the minutes of January 11th, 2022 with one change, which is that it did, the printed copy we got said that that MSBA asked in the past tense for the town meeting to vote on it, and we are going to change that to will ask. The recording, it was ask. It didn't have a D on the end.
Okay.
So that's the change, and I make a motion to approve it with that change.
Is there a second?
Yes, second.
Moved and seconded. All in favor, say aye.
Aye.
Opposed? That passes 5-0-0. And is the motion to approve the minutes of the meeting of January 18th, 2022?
So moved.
Second.
Moved and seconded. All in favor?
Aye.
Aye.
Opposed? I'll abstain. I was not present, so that's 4-0-1. All right, next item on the agenda is the approval of the warrant. Chair will entertain a motion.
So moved.
Second.
Moved and seconded to approve the warrant as submitted. All in favor, say aye.
Aye.
Opposed? That passes 5-0-0. Next up is public participation. And actually, before I start this, I apologize for this. I should have read into the record the virtual or the remote language regarding tonight's school committee meeting. It's in-person attendance limited to 18 people. Masks are required. Attendees will need to practice social distancing. The public can also access this meeting via WebEx technology. The Burlington School Committee will hear public comment in person and virtually. Meetings are also broadcast live on the cable access TV. For those looking to join via WebEx tonight, you can go on the WebEx website. The meeting number or the access code is 2340-761-3878, and the meeting password is Tuesday. So I apologize for not reading that right up front. But getting back to public participation, I'll remind everybody that we have a policy of a 3-minute public participation. Mr. Kluner is going to be handling the muting and unmuting. Hopefully we can move forward pretty well with this procedure tonight. We will be keeping an eye on the 3-minute agenda because we've been letting that slide a little bit recently. So with that said, anybody who has something to say in public participation, and this is for items that are not on tonight's agenda, if you want to speak on an agenda item, we'd ask you to wait until the agenda item is reached. Anybody for public participation? I'm going to start with in the room here. Yes, ma'am.
Hi, good evening.
Yep.
Oh, I'm so sorry. I need my son to help me. He's that person. Okay. Timer starting.
Good evening.
Hi, good evening, everyone. I'm Joyce Curry. I'm a town resident. I have 2 children in the system, and this is my 22nd year as an educator. I was coming just to talk about negotiations. Negotiations imply both sides are working towards a common goal, a goal with what is best for the children and future citizens of our country. But the BEA is being told some issues that we, as professional educators, deem important and necessary for the quality education of our children are non-starters, period, end of discussion. Instead of being able to bring ideas to the table, to collaboratively discuss how to improve our children's education through sustained professional development and time to collaborate with colleagues, we are just shut down and told, non-starter, can't be negotiated. Listen, after the last 3 years, we all know collaboration's key. You all serve on the school committee. You care about the students of the town. We became teachers because we love working with learners and have the desire to give them the foundation they need to be successful citizens. So we have shared goals. Our negotiating team has been forced to dedicate an absurd amount of time and energy to these negotiations. But our professional expertise is meaningless if changes to planning time and professional development are off the table. It's also demoralizing to be reminded that in 1995, 27 years ago, we were given a great raise. And we were given that raise in exchange for working more days. We need time to collaborate and plan with our colleagues. We need relevant and high-quality professional development, and these are the practices that other districts in our Commonwealth employ. All I'm here asking for is a fair conversation, to have the opportunity to negotiate and be listened to, and not to be ignored. That just creates contention, frustration, and as a history teacher, it's such a terrible lesson to model for our students and our future citizens. And I appreciate you taking the time to listen to me. Thank you very much.
Thank you for your input. Thank you for coming. Yes, sir, you here for public participation? Please. Come up. Please introduce yourself, and floor is yours.
Can you hear me okay?
Yep.
My name is Douglas McKinnon. I'm a resident here. My name is Douglas McKinnon, and I'm a resident here of Burlington. I have 2 children currently in the high school, and I've put through 2 already. My question is along the COVID guidelines. A short introduction here. It's been 2.5 years of wearing masks and social distancing at school. Masks that the CDC now tell us, such as this one, that are unfortunately useless, as they're not N or K95. Omicron numbers are crashing like a lead balloon. Many teachers and children have antibodies from either prior infection or vaccination. There are reports throughout the country of students suffering from depression and isolation. So my question is, so what metric does the school board or the DESE need to see to revoke the mask mandates and get back to some form of normalcy? Thank you.
Thank you.
With a question like that, I think I'd like to let Mr. McKinnon know when we might have an answer. We don't know when DESE will have a number, and our decisions are clearly determined by mandates from DESE and situations on the ground, situations here in Burlington. So I don't know that we can give you a direct answer right now, but as things continue, we will continue to, notify parents as much as we can. I was just remembering that we were looking, when we first voted on this mask mandate in Burlington, it was actually 1.5 years ago, in the summer, we were looking at numbers like 2% positivity, and would that trigger masks, or would that trigger no masks? And now we're, the numbers are definitely coming down, and that's encouraging. But we're still, I don't know what the numbers are this week. The last time I looked, it was like 13% positivity. So, people can look at different numbers, and I don't think we can give you a definite answer. I believe Dr. Conte and Mr. Larkin are keeping up with that information. So I don't want to spend a lot of back and forth, but you asked a question, and I wanted to answer what I knew about it. And if there's further information, we will certainly be sharing that with parents.
So no metric.
Yeah, again, through the chair, I think it's always changing, but the metric was 80%. So that was the metric, 80% vaccinated, but the definition of vaccinated may change. So we're looking at that. Reassure Mr. McKinnon, I don't like masks either. We're going to look at this. The state has masks in place through the end of February, February 28th. So it's not a local decision until after February 28th, and we'll look at the metrics after that time. So there's no desire to prolong this any longer than the rules allow us to.
So after February, it's your decision?
We don't know.
Again, through the chair, I can't answer that yet. The state's been making that decision month by month. They may give that decision back to the local district at that time. They may not. I don't have an answer for you.
Okay. But, so they're not recognizing natural immunity at all? Like, how many children have actually had COVID at this point?
I'm going to just jump in here, Mr. McKinnon, we can't argue frankly on Desi's reasoning.
I don't think I'm arguing, sir. I'm just.
No, I know.
You're asking
No,
questions.
but you're asking why Desi's not doing something, and that's not ours to answer, because I agree with you, by the way.
As a parent, I'm just trying to understand here. It's been
No.
2+ years. And,
You're preaching to the choir here, believe me. But DESI is the one that makes the call, and they've determined that up until through the end of February, as of tonight, we have to have masks. Now, if you ask me to rationalize that and give you a good reason, I can't. But it wasn't my decision, it's their decision.
Mr. Chair, again, if I could just come get your number, and I'll gladly call you tomorrow, and we can go through some of the details if you'd like, and some of what we have to do, and what's our choice, and what's the state is requiring us to do. I want to make sure I answer your questions.
Bob, is there anybody else? I think that's it for in-house. Anybody else online who wants to participate?
Through the chair, I have a request for online. Is it possible, Mr. Cuna, for you to, I don't know what it's called, but pin the speakers so we can maybe see them a little better when they are speaking? If that's possible, that'd be great. If not, I get it. Thank you.
So right now, through the chair, I see two members of the WebEx meeting that have their hands raised.
Okay.
For those members that are on the WebEx, if you open up the participations tab and hover over your name, you have the option to raise your hand. I know there was some confusion last time, so I wanted to make that clear. You should be able to open up the participation tab and hover over your name, and then you have the option to raise your hand. So right now, the first person is Kerry Malm. I hope I'm pronouncing that correctly.
Okay, Kerry Mom, if you're out there, the floor is yours. Is she muted?
She should be able to.
Hi there. No, I just got unmuted. Can you hear me now? Oh, hello?
Kerry, can you hear us?
I can hear you. Can you hear me?
You're unmuted on our end.
It's unmuted on my end as well. Can you hear me?
We cannot hear Kerry, it sounds like other people might be. We're going to see if we can fix that.
Can you try and speak again, please?
Can you hear me now?
There you go. Okay, thank you.
Oh, it's fixed?
It's fixed.
Oh, okay, great. So I'm Carrie Malm. I have two students at Fox Hill, a first grader and a fourth grader. And I'm speaking here tonight because I've sent a few emails that have gone unheard and unresponded. And I know a couple other parents have done as well. And it is leading us, quite frankly, to feel pretty ignored. I'm happy to see that some of our protocols are going in the right direction with the removal of contact tracing and test and stay. I wanted to share briefly what my first grade son has dealt with in the last 3 weeks. He is unvaccinated. Both my children are. He was considered a close contact in his class a few weeks ago. he was able to test and stay in school, and it was great. Last week, he was considered a close contact after school. He was a close contact on Tuesday. He attended school all day Wednesday, all day Thursday, all day Friday. And then Friday at 2 o'clock, I got a phone call that he was a close contact and needed to be picked up and quarantined until the following Tuesday. So after 3 full days of being in school, I then had to leave work on Friday and come pick him up. Luckily, it was a long weekend, so he didn't miss much school. But again, I expected that to happen again. We got the email recently about the change in the close contact and test and stay, and that would be no longer, and that made us really happy. We felt that was a logical decision. However, we got an email yesterday from the after school program saying that those policies do not apply to before and after school. So now my children are still in a situation where if they are a close contact at before or after school, they still have to quarantine for 5 days because they're unvaccinated. I sent an email last night asking, first of all, who makes these decisions? I'm not sure who makes the policies for before and after school. Second of all, why can't we reinstate the test and stay program for ASP and BSP? I realized that the scale was too large for being in school and it made sense to not sustain that. However, this would be a much smaller scale and it would allow these children to stay in school. Having them out of school again for 5 days because of a close contact in before and after school seems absolutely ludicrous to me and unfair for our unvaccinated children. Basically, it feels like a punishment that because their parents work full time and they attend the before and after school program, that they will be the ones that have to quarantine. Kids that take the bus or that are able to have their parents pick them up will not be in that situation. I think the school needs to do better here. I think before and after school needs to make a different protocol. My other question, and I'll wrap it up by just asking, kind of similar to the previous caller, was has there ever been a case of COVID spread in the before or after school program? So I would love to see some documentation that there has been, because I know that where the district that I work in Lincoln, they have said that the test and stay program, 99.7% of those that were tested in the test and stay program were negative. So if there has been COVID spread in before and after school, I would love to hear about it. Otherwise, that needs to be done. These kids do not deserve to miss 5 days of school because of a close contact in before and after school because I have to work. Thank you.
Again, Mr. Chair, COVID is on the agenda, but I think while the questions are fresh, if we could just interject, I think there were lots of questions, and there are some technical answers that I'm not quite sure make sense, but the before and after school programs are under EEC, not under the Department of Elementary and Secondary Education. There are some before and after school programs that exist in schools, like in Burlington. There are others that exist in other facilities outside of schools. Both agencies set their own rules. We've been petitioning because it is, we feel, a little bit confusing to have an after-school program in the same school following different rules. So what we sort of finally came to is if the before and after-school program can follow the mitigation factors that exist during the day, that they can sort of fall under the same umbrella so that we won't have close contacts or again, there's no longer a need for test and stay in the after-school program. What? There's no more test and stay. So I'm saying we'll follow the same rules in the after-school program, Mrs. Munn, as during the day. So I hope that answers one of your questions.
Okay, so I'm sorry, just to clarify, are you saying that that's going to go away, that there will not be close contacts in the after-school program moving forward?
I'm going to say the after-school program is going to operate in the same way as school.
Okay, so that email that we just received yesterday is going to be rescinded?
Yes, the email was correct. We needed to get, it was a different agency. We needed to get, we needed to make an exception, and we are making that exception.
Okay, thank you.
You had asked another question about, one thing I would just want to be clear is that the rules for school have changed, but the rules for at home have not. So there's still a distinction between who is a close contact if there's a positive in a home And again, that's under the guidance of the CDC, not the Department of Education, which schools are. We are hoping to support that as best we can in the coming weeks by sending home tests with students who opt in. So again, we have COVID coming up on the agenda. I think, Patrick, if you put out the opt-in for staff and for students, and again, we would encourage families if they want access to the tests, and we will accept test results from home. Then if you can opt in your child, then we will be sending home tests with your child.
Is that it? Chris?
Dr. Conte, with regard to the question by the gentleman in the audience, I've been asked by quite a few parents who have really had it with masks. Of course, there are other parents who are terrified not to have masks, so, you know, it's a tough balance. But these parents have asked me if we are at 80% at the high school, and if we are, would you please consider applying for a waiver from the mask mandate? Not that you could use it at the moment, but that you would have it available for when it is open to be used.
Mrs. Monaco, absolutely. We'll apply when we can. I don't like the masks either. There's lots of caveats with that, and again, I feel like I'm always making excuses. But the definition of who is fully vaccinated has changed. So right now it is 80% with 2 vaccines. If that changes, then we will adjust to that change. But again, wherever that marker is, and right now the metric is 80%, and that's for 16 to 19, and I think they also changed it for 12 to 15 as well, and we might not have been at 80% last time I checked for the 12 to 16 age group, but we'll follow it. If we have the opportunity to apply for a waiver, we can apply, but my understanding is the state rules will stay in place until the end of February.
Okay, I understand that, but I believe that we're at 80% at the high school.
Last time I checked, we were right at 80, yes.
Okay, so my question is, will you apply? I don't understand what would stop you from applying. So my question is, will you apply?
Sure.
Because that's what people want to know.
Sure, yes. If again, I still think the decision may need to come back here, but we will, if we have the opportunity to apply, I will. I just need to go back and check the rules, Mrs. Monaco. Honestly, I don't, they change all the time.
Okay, so if there's a problem, let us know, but otherwise you will apply.
Yes.
Thank you.
Martha?
I also, though, would like to know, I know there have been a few districts in the state that have applied for and gotten waivers, and I would appreciate it if you would check in with those districts to find out if there was a change in the numbers or the school spread or whatever. What was their experience before we decide to go that route? So I'm not as convinced as Ms. Monaco sounds, but I would like to know more information. It may be fine to have the waiver in case we need it. So,
Yeah.
thank you.
So,
Martha, I'm not convinced. I just want to have the waiver in place in case we have the opportunity to use it, and it's the appropriate thing to do. Like I said, there are a lot of, I know my own grandchild won't take off his mask in school, so he won't eat lunch. And he'll probably wear a mask for the next 5 years. But there are other people who feel differently, and I think if we could have the waiver in hand, then we could decide whether or not to use it.
Okay, this is public participation, so I prefer to get back to that.
stay in the positive.
Bob?
There's one more member on WebEx, Adam Sinesi.
Mr. Sinesi?
Thank you, Mr. Chair. The last topic stole a little bit of my thunder. I do understand that Norwell and Cohasset, some of the schools in that district have been without masks. What I'd ask the committee, if possible, if we are within at the high school level, I saw data last week that 16 to 19 are 80% vaccinated at the high school level, and there's another 8% at the high school or in that 16 to 19 age bracket that have received one dose. So my question is, at this point, if we're within, I realize that the high school age probably begins closer to 13 years of age, but if we're within 3 percentage points, I do think it's time to get that process moving, to get the waiver point put through. And I think it's time for the district to get a hard count on what the percentage of vaccinated students at the high school, at the very least, is at this point in time. That's it.
Thank you. Anybody else, Bob?
No one right now. I don't know. I don't see any hands raised.
Anybody who wants public participation, if we've missed you, wave your hand at the screen so we can see you. Nobody? Going once, going twice? Thank you. All right, moving on. Informational reports, subcommittee reports.
I know Beth wants to do one.
Go ahead, why don't you introduce that one?
Beth, are you there? Bobby, unmute her. Beth Colburn.
Hi.
That's bad.
Sorry, I
Sorry.
couldn't unmute myself. I'm Beth Colburn with the CPAC. I have 3 kids in the district. I just had a couple of updates and then a question. CPAC hosted our monthly caregiver support group last night. Our next meeting next month will be February 23rd. Information for that is on our Facebook page. We're seeking new board members for next year. Nominations take place in the spring, and voting happens at the end of the year. So if you're interested in supporting the work of the CPAC, please reach out to a board member if you have any questions. And I'm seeking one update about communication boards in our school playgrounds. We had asked in the fall about having communication boards at the playgrounds. I know the rec department is going to be putting them in town playgrounds, and it would be great to have those types of supports for kids in school playgrounds. And I was wondering if there had been any movement on that topic.
Again, through the chair, Ms. Coburn, the committee was voiced their support. I think we're putting our budget together. It would probably be a capital item for us that we would explore as part of the budget process. So I think that's the it's in the works, I guess, is what I would say the update is.
Okay, thank you.
Thank you.
Thanks, Beth.
Kyle, did you have one?
Thank you, Mr. Chair. Just an update from the town-wide DEIC. We met this past Wednesday with Amy Warfield from the clerk's office and Joanne Faust from HR to just kind of review a bunch of documents that some contracts and language relating to the town, and just kind of view it through the lens of DEI. And we had a bunch of questions, and it was a very productive conversation with both women. And we're going to meet again, and then in 2 meetings, we'll present to the select board just kind of our recommendations moving forward. We're getting closer to having more in-depth conversations with regards to schools, and if Mr. Porch is on the call, expect an email from either myself or Dr. Addison Reed to get an invitation to our future meeting.
Thank you. Any other subcommittee reports? Seeing
Do
none.
you have anything? No.
Moving on, Ways and Means. Roger, you up there? Anything for us?
I don't see Roger on the meeting.
We have a
No.
meeting with him tomorrow
No
night.
sign of him?
Again, Mr. Chair, we'll get out dates, but we did have a capital budget meeting on the Article 11 before town meeting was postponed. And then I think Roger did send out a date for the Ways and Means Subcommittee. Bob, is that correct?
Tomorrow night at
Yeah,
7.
tomorrow night.
So we'll make sure you
Okay.
all you all get that if you want to attend.
Thank you. Student representative, is Brooke here? Nope. Okay, Ms. Hovas couldn't join us this evening. Moving on to learning. Dr. Conte, Poet Laureate.
Thank you, Mr. Chair. We had some scheduling issues, but Bella Gill is the Poet Laureate for this year. And as we have, I think, done annually, we are usually get the privilege of a recitation. And I think that we're going to try to get Bella on the agenda for our next meeting. It's always a pleasure when the Poet Laureate comes. I also want to mention that for the first annual, we had a faculty Poet Laureate. And so the winner of the first annual faculty Poet Laureate was Stephanie Diozzi, so from the high school. So I want to congratulate Stephanie as Stephanie as well. And I'm not sure I can talk her to coming into a school committee meeting, but we'll try.
Thank you. Next item under learning is the Burlington High School Program of Studies, second reading.
Thank you, Mr. Chair. We did get some feedback. I left a sheet at your desk. We got a request for some more flexibility with placement in some of the advanced courses in the science and math department. So we added some different percentage ranges. It used to be, I think, a 90% with no opportunity to score below that. So we wanted to make sure that we were offering some flexibility. And then I think there's a key provision at the end where the administration, you can see it highlighted, can make for specific adjustments for individual student needs. Especially after COVID, we're seeing more students who've kind of taken either a non-traditional or a wandering path with some courses. And so we're just needing to be a little bit more flexible as we come out and trying to get students in the proper placement. So that was a change. We also got some feedback on some, I would say, largely non-substantive changes. And my understanding is all those were incorporated into the Google Doc to the committee's satisfaction. So with those two changes, I would recommend the school committee approve the high school program of studies for next year.
Is there a motion?
So moved.
A second.
Second.
Moved and seconded. Any discussion? Chris?
I would just like to add that I would request the high school look into the possibility of using standardized testing for the opt-out classes. Let me give an example. If a student wants to skip over a prerequisite for whatever reason because they feel that they don't need to take it, there's a test that they take, and there are other opportunities that maybe they don't have to take the test. But when they do take the test, I believe it should be standardized, like the accuplacement test that's used at Middlesex Community College. I think the problem with the tests as they exist are that they're made in the school, and it's really very subjective what's put on the test. So I would just like to make that recommendation. I'm not going to vote against it or anything. I would just like to see the testing that's used for that specific thing to be standardized.
All right, any further discussion? Seeing none, we'll put the motion to a vote. All in favor, say aye.
Aye.
Opposed? That passes unanimously. Next item under the learning is calendar revision. Dr. Conte.
Thank you, Mr. Chair. I'm going to hand this one over to Patrick, so you're tired of listening to me.
So, because of the day that we came back and had a snow day to help get staff tested and get ready for our new protocols, we ended up utilizing a PD day that would have been March 9th. So we would like to return March 9th to a regular school day to keep us on schedule.
Okay.
Sounds good.
Martha?
Regarding, so we had we used the PD day from March 9th, which I support doing that. We also had a snow day. So does that mean then that the last day of school is now one day later than it was before? Okay, thank you.
Do you need a vote for that?
It would be great.
Okay.
Just the calendar is,
Chair will entertain a motion to modify the Burlington School Calendar 2021-2022 by moving March 9th back to a regular education day.
So moved.
Second.
Moved and seconded, all in favor?
Aye.
Opposed? That passes unanimously.
Can I make a comment?
Sure.
Can we make sure the parents are fully aware of that, because it's a change that they may not be expecting?
yes, Mrs. Monica, we'll try to get the word out. And then I'm already getting messages and emails about, I realize it may snow this weekend. So we are aware. I bet you all weren't aware that we are blessed in this community with many meteorologists, many young meteorologists. They're already advocating for a snow day.
So no school on Saturday?
That's what they're saying.
School Saturday.
If it's real bad. All right, next item on the agenda, on equity. Transportation update, Dr. Conte.
Thank you, Mr. Chair. I just, this was a conversation that actually started in the fall when we were sort of untangling our bus routes for the first time, that they were running at full capacity. And it really involved sort of a team conversation. So folks from the high school, it involved Bob, it involved Ray Porch, I think Patrick was there. We had a bus that was persistently and consistently late getting to school. And you know, with the 3 tiers, getting across town was difficult. I even think we talked about this with the committee earlier in the fall. There are lots of confounding factors, but none of the factors are obviously the fault of the students who are late. And I think that if we are true about focusing on equity, we have to make sure that all of our students get to school on time. So the bus that we were struggling with is bus 18. It was coming from Fox Hill on Tier 2 and then needing to get all the way to 3rd Ave and then stop and pick up at Lord Barron and then get back to the high school. So I think what Bob did is work with the bus company. And Bob, thank you, first of all. And we've created sort of a bus 19. We've added a bus, and it's a Minuteman bus that is already over that side of town, that is sort of done with its routes. Bob, is that correct? And the bus company is letting that bus then start from basically over that side of town already, 3rd Ave, and it stops at 3rd Ave, Lord Barron, so it relieves some of the bus 18 stops, which accelerates bus 18, and it gets those kids there. And Bob, you've been telling me it's been arriving 5 to 12 minutes earlier, so it's getting to school before homeroom, which I think is important for all students. But I think it's going to be a persistent problem. We obviously need to pay for the bus, and we are doing so. But it may be something we need to build in. As the town becomes more congested, Bob, what's the time between tiers? 20 minutes, 25 minutes?
25 minutes.
25 minutes. So it's tough for us to get buses from one side of town to the other side of town to pick up. So we're just going to have to do some more work. And again, I think it was exacerbated because the bus company this year was having trouble finding drivers, as you all know. And so they said they had the bus, they didn't have the driver, and we finally got the driver. But I think it was, there were a lot of people who contributed. Again, I just want to make sure Mr. Porch really made sure that this was a focus of ours, so I want to give him some credit. Transportation often falls off the priority list, and once the routes get established, and he didn't allow that to happen. And again, Bob was really persistent working with the bus company. So it's really the two of them that work to get these kids to school on time, and so that's why it's really falls under equity, because transportation usually doesn't, but this was a real equity problem. Bob, the bus is costing us,
I'm sorry, so the bus is $75 per day.
so it's $75 a day, and so
We're going to have it for the rest of the school year, I assume? Is that the plan?
Through the chair, if I could just add. So obviously, right now, it's exploratory. So we started light with just 2 stops. We were at a higher capacity, not over capacity on bus 18 on that tier for the high school. So that relieves some of the pressure of just getting some of the students off of that other bus, and then, of course, the timing to get there. So right now, we're only in week 2 of that. We do have the bus to the rest of the year if we want to, which it looks like we do. But we need to explore, obviously, to make sure that the timing remains low and whether or not we need to offset any additional stops. So we're going to keep watching that.
How about the financial end of it? How are we going to handle that?
It's not planned, so we obviously have to look at that budget to make sure that we can handle that.
You'll let us know.
Any questions on the transportation? Seeing none. Next item, state ARPA earmark for Burlington and Woburn. Dr. Conte.
Thank you. Again, this is really, I'm going to have Patrick jump in once I do the technical stuff, because it's really been the effort of a team of folks in Burlington, and I think Patrick can speak to their efforts in his own better than I. But Senator Friedman, essentially Matt Crowley, Superintendent Woburn, and I were approached from our respective staffs about a growing need in both of our communities, and we contacted our State Representative Gordon and Senator Friedman, and Senator Friedman I think was concerned and wanted to support our efforts and the efforts of our staff. So she worked with the federal dollars that have come into the state. I think you've read about some of the earmarks going to other departments. She got a $300,000 earmark for the city of Woburn and Burlington, town of Burlington, to collaborate. And I'll just read the description because I think it says it best from the earmark itself. So, not less than $300,000 shall be expended to the public school systems in the town of Burlington and the city of Woburn to develop a pilot program in partnership with local primary care practices to deliver primary care health services to low-income children enrolled in public schools in the town of Burlington and the city of Woburn. Provided further that such pilot program shall include the delivery of primary care services while a child is in school. Provided further that the public school systems in the town of Burlington and the city of Woburn shall provide an annual report to the Department of Elementary and Secondary Education, the House and Senate Committees on Ways and Means, and the Joint Committee on Healthcare Financing that details the status of the pilot program, which shall include but not be limited to the amount of money spent, the number of children served, the types of services provided, the barriers for children to receive such services, and any recommendations for sustaining such a program beyond the pilot program time period. So again, we're the dog that caught the bus now, and now we have to figure out, work with Woburn to figure out what the details are, and I think Patrick can speak to some of the work that's ongoing. And again, I really think the staff really have been working on this issue.
Yeah, again, it just comes down to our equity statement about supporting students and giving them whatever they need to develop and be in school. So they can't be in school if they don't have the health care they need, the physical forms, the immunizations. And it's difficult to welcome them and do their registration work and tell them, come back when you have a physical. There's this place called Lynn that you don't know about, and you may not be able to communicate with the people at the clinic there depending on where they're coming from. So it's, again, if we're really going to live our equity statement that you all developed, we're trying to do more to support these students and their families and get them in school. So really credit Carrie Lamprey. She works with a lot of students that had some needs, and So we connected with folks in Woburn. They have a lot of similar students, and kids are missing days because they don't have basic health care met. So we're fortunate to be on a pathway to start to chip away at this, but there's a lot of work to be done, and we're hoping for something a lot bigger down the road. So our kids are in school, and they can do what all of our Burlington students do without having to worry about how to get some basic health care needs met.
Excellent.
Again, a concrete example is Patrick and Mr. Larkin, Mr. Porch. I think Ms. D'Souza took a group of students to borrowed a lab van and took a bunch of students to Arlington for physicals. I think it was about a month ago. So again, during the evening, during their own time, and I think it was about 8 or 9 kids. And so that allows those kids to stay in school. And Lab happens to be turning over their van fleet this year, so we're asking them if it's, I'm not sure how procurement works, but we're asking them if we could maybe pick up one of their vans so we would have it available, and then it may also help us relieve some of our afternoon athletic issues with smaller teams like cross country or golf or something. We could help not necessarily get delayed for buses. So we'll, if that's a possibility, we'll come back to the committee with that.
Thank you. Questions or comments? Chris?
When do you expect this to be in place? How long will it take? What's the plan?
I mean, that's,
I know you're working
that's a
on
broad
it.
question. I don't know. I mean, I don't really know exactly what you're asking us.
So the partnership with the local primary care and having this whole thing actually up and running?
Without support from other community stakeholders, it's probably going to take a long time. That's all I can say. So we're in the kind of exploratory phase of seeing who can work with our students. We need medical professionals first of all. We have to talk about the costs for the services that we need. Ultimately, I know our long-term vision would love to be to have a clinic located in either Woburn Public Schools or Burlington Public Schools that we could both access during the school day or after hours, but in the physical site. So we have some grand vision, but I mean, if people are listening and they have connections and would like to help us solve this problem, we were very fortunate. We had a Woburn parent, a doctor, reach out to us who opened his practice after hours in Arlington to allow us to get these students' needs met. So again, that's a Band-Aid, and we're looking for a permanent solution. So I don't have a solid answer. I know this money will go a little bit of that way to help us get started, but there's a lot more work to be done to make sure this just isn't, something we can do over the short term.
Knowing of pediatric practices that would probably be willing to help out, but they're distant, so we want something right here in Burlington and Woburn, correct?
Yeah, I mean, one of the significant problems for a lot of the families is transportation. They don't have necessarily access to transportation to go a long distance.
Right. So I guess my question is, if we can put something like this in place, where do we get do we need doctors? Do we need physician's assistants? Do we need nurse practitioners? What do we actually need to do in order to make it work?
Again, you're asking the wrong person. I do know from talking to Dr. Altman, who is the kind doctor from Woburn that helped us out with this first phase of getting some students some medical needs met, that he has some connections, and we talked about what's been done in another community where they bring a number of students together, and they have some one doctor oversees a number of people that aren't fully finished their work yet as doctors, and would do the physical work to do a physical, as he said, is not complicated. So ultimately you would have a group of individuals that were coming to help out, and if there was something that came up during a routine physical, you would have a doctor there to step in. So that was one example. I'm sure there are a number of ways. I know it's done in other places. And we've talked to folks in Gloucester, we've talked to folks in Malden, and we're just trying to see, again, what works for Burlington and Woburn to meet the needs of their students. So open to anybody that would want to have a conversation, that has thoughts and ideas, because that's where we're in right now, is trying to come up with a concrete plan now that we know there's some financial support around the corner.
All right, sounds great.
Martha?
I'm very excited that we have this opportunity, and it's obviously going to be a lot of work to make it work. And I thank you for the initial steps, and probably you don't know the answer to all my questions either, but with $300,000, is this a sense that that's enough to get it started? Do we have any sense of, is it supposed to be used in the first 3 years, or 1 year, or do we have any sense of that timing?
I think it's going to depend on the program design, but the intent behind the ARPA funds is to be seed money. So I think it would get us started, and then we would look to, we would want it to be something that's sustainable. I think this population isn't going away, and I think it's going to be a continued need. Whether that affects our operating budget or other things, I can't say, but I do think we need to have kids in school. So that's what we'll do, and it's a sort of, I'm not going to say a new need in the community, but I think it's a growing need in the community, and so we need to make sure it gets addressed.
And my other question is, in our backup material, you mentioned the possibility of using mall space, and is that something that you can talk about now, or does it look promising, or is it just an idea in somebody's mind?
It's probably just an idea in my mind, I think, but I think you all have aware of the Simon Academy at Burlington that operates in the evening, and our work with the Simon Youth Foundation. The Simon Mall in Burlington has been a good partner as well, and they're undergoing renovations, and I think we've been advocating for space for many years now. And so I think how we approached them several weeks ago was we didn't want to think that we weren't contributing anything. And again, when I say not contributing anything, we would be contributing talented teachers, which is the most important thing. But I'm saying in terms of the space, we felt if we had this money and we could partner with the Simon Youth Foundation and the Simon Company, that we could maybe have a possibility in a good location where there's lots of traffic. Many of these students work in the restaurant industry. And if they could get their classes and get some health care, and we could benefit from, again, an alternative program. I know that, again, Superintendent Crowley in Woburn was interested in looking at that possibility. So one of our challenges in Massachusetts is our districts are relatively small, so we don't necessarily have a sustainable population, but if we partner with neighboring districts and we can develop good programs, then I think we can create the populations to make the program sustainable. So that, again, Ms. Simon, I think I wrote that down maybe in I was dreaming a little bit, but again, that's not definite, but I think the work that Patrick has been doing with his staff has been really concrete and really needed. But I think we need to have a local, again, a local option, because these are our kids.
Yeah. Well, thank you, and I encourage your dreaming and your visioning and trying to think outside the box. So if there's things that the community or that we can do to help, make those connections, let us know what we can do.
Thank you. Bob?
I just want to give Nicole Kasha an opportunity. She did
Sure.
raise her hand, and she put it down, so I'm not sure if maybe the information was already spoken.
Hi, Nicole.
I'm worried I made a procurement mistake.
You probably did.
Hi, I just wanted to add, Martha asked when those funds were available through. In speaking with the state today, it sounds like those funds are available through 2027.
That's great, thank you. Can I say one more thing?
Sure.
Eric, my understanding about all that is that the physicians, in order to do the work, they have to associate it with their practice so that their malpractice insurance covers them. And I wonder if providing a facility where volunteer doctors could come in occasionally, not every day, of course, but I wonder if the seed money should go to a facility and try to encourage volunteers to come from their private practices to do some of the work.
Again, I think those are the type of details that we need to speak to doctors about, because they would know the specifics of their insurance. I just know typically with our district doctor, they need to get an extension on their
Yes.
practice insurance to do that. So I'm assuming it would be the same thing, but we're going to explore that. Again, the money was essentially just awarded, it sounds like, through Nicole. We'll have it for several years, and I'm not sure it'll last that long, but I'm saying I think that's something that is valuable. We just have to try to work out the details. So really from this board, we just need a commitment to serve these kids, and we'll get expertise, we'll listen to everyone, but I just think if you all are committed to having the kids here, we will make sure that they get here.
Can you use that money to cover that malpractice issue?
Possibly, I'm not sure there are restrictions. Again, Nicole will make sure I don't spend it improperly, and it might be something that we can do.
Have we approached any of the local businesses in either town? Again, with a lot of the work from home, there are a lot of corporations who have a lot of space available, and they might be willing to give some space up for free because they're donating it, and there are a lot of, I know my company wants to give back to their local communities, so I don't know if that's a possibility too, because they've got space, that they're paying for that nobody's in.
Again, the Burlington Chamber, Area Chamber of Commerce is always very supportive. We can certainly approach them and ask for some space possibilities, and it just might be the temporary nature of it. I think the reason we were thinking the alternative school might be the best option is because it would be open every day, and it just might be part of the wraparound services they're called. So not just academic, but we would have vocational services, healthcare services for students in the program. So again, I think that's a great idea, and again, we're really open to any idea. Tonight's agenda item was just to make the committee aware that Senator Friedman really advocated for us. I'll probably send her a note on behalf of the committee, and that we still have some planning to do, and that we're looking forward to working with the city of Woburn to try to address some of these needs. And I'm hoping you'll see more and more of those inter-district partnerships, because it's really hard to solve these issues only as school departments, and again, we hope the municipalities we'll work with the city government and certainly the town here in Burlington to help address the needs.
Okay, thank you.
Can I ask a quick question about the ARPA funds? Do they roll over, or do you have to use the 300 in that year, or, is it related to sort of the calendar year, your fiscal year?
To paraphrase the question, people couldn't hear you. The question was whether the $300,000 rolls over every year, or is that just $300 that has to be spent by 2027? Is that correct?
Again, Nicole can answer that question, but I believe we have to spend the funds by 2027, so it would basically roll over until the funds were expended.
We don't get a new 300 every year, I don't believe.
Or every 3 years,
Unfortunately.
And is there a limit on what it covers?
I don't think we know all the rules yet. The news just came out within the past week or so, so we're still trying to learn the details, but I'm sure there are.
Yes.
We just have to familiarize ourselves with them and then coordinate with Woburn to try to make it work.
And like any grant, we would have to submit a budget proposal. We would have to say whether it's salary, whether it's supplies, materials, whether it's insurance. we would have to identify what we're spending it on and who we're serving. So we can, as that evolves, we'll certainly take it back to the committee moving forward.
Thank you. Thanks to Senator Friedman for her assistance with that grant. Moving on. Item 8, Culture, Relationship, and Thriving. COVID update. Dr. Conte.
Thank you, Mr. Chair. First of all, I got a question about this agenda item, and I wanted just to make sure that we revisit it. Sorry, I'm a little tired tonight. The word thriving is very purposeful, and it really comes from the equity statement that the committee put together. So just to remind everyone, this is your statement. Educational equity means that every child belongs and receives whatever support they need to develop her, his, their full academic, emotional, and social potential to learn and thrive every day. This begins with kindness and valuing the humanity of every child or individual. So that's where the thriving comes from. It really comes from the mission statement from this committee. So we have a new COVID update, and again, I'm going to ask Patrick to start. I think we got the initial announcement on Thursday or Tuesday of last week, and then we are implementing as quickly as we can. So Patrick, with that.
Yeah. Speaking of kindness, I just want to say, like, it's not most of our parents, but some of our parents have been a little bit impatient and not, like, we don't sit here and make up these rules. And some of the emails have not been the kindest, threatening employment, things of that nature. So I just want to echo kindness as kind of a core value around here. We're all frustrated by what we've been dealing with the last 2 years, but none of us worked in a back room to create any of this. So just want to keep some perspective. But we are happy that the protocols are lightening up, and that we're able to keep kids in school and not have people feel like their children are being treated differently because we decided something, but we're just implementing state and federal policies. So we're happy that the Department of Education, I wasn't optimistic that they would be as quick as they were, because usually they're even a little slower than this switch. So I appreciate that for them listening to us, what's happening on the ground in schools. And we're able to, at this point, stop contact tracing and keep kids in school. And if you're sick, it's almost like the old days. If you're sick, please keep your kid at home. So the at-home testing policy, I'll talk about a little bit. Like, we sent the opt-in to families and to staff. We had about 250 staff members so far sign up for the at-home testing. Those are due to arrive sometime this week, is what they told us. And tomorrow there's a webinar for the family opt-in testing. We already put out the opt-in forms for families. And I think this morning I talked to Rosemary. I didn't get an update this afternoon, but just sent it out yesterday. We already had over 400 families sign up. I'm assuming that's going to at least close to double, if not triple, in the next day or so. And so the way it's going to work is we're going to ask families to test their child on Monday. They'll get 2 tests every 2 weeks for each child if they sign up for each child, and to test them on Mondays. And if they pop a positive, to keep them home for that 5-day period, and they would return on day 6. If they're negative, we don't need to hear about it. A couple of the questions I've had, and again, I just want to reiterate, I'm not a medical professional. I listen to the people that they have on these DESE webinars and the DPH, and that's the source of my information. So I just want to put that out there. One of the question was, my child or I have had COVID in the last 90 days. Should I even bother with this? So what I've been told is there's 2 different kinds of tests. One's a PCR test, which is a little bit more, I guess, drills down a little bit more, and you could test up to 90 days afterwards positive on a PCR test. An antigen test, I've been told, is if the virus is active in your nostrils and you do the test, then you're going to hit positive. The doctor on the call said he has seen breakthroughs, like people getting COVID within the 90-day window, sometimes within a couple of months. He said there's no harm in people testing, if they had COVID last month and they want the test, like test on the Monday and check. He says there's no harm in that. So anybody that's had COVID, Anybody that's vaccinated, unvaccinated, everybody's welcome to take part in this and get the at-home tests. All we're asking, again, to reiterate, is staff and students would test on Monday morning before school. There's a form we're going to send out that they're supposed to, if they hit a positive, to let us know. And if they're negative, we don't need to know about it. You just go to school like you normally would. So I'm optimistic. I'm hoping this means that we're getting back to kind of the way things were pre-pandemic. I'm hoping we don't have any bumps in the road as we move forward into the spring. That's my hope. We can talk about removing masks when the opportunity arises. So that's what we're all hoping for at this point. And I'm happy to answer questions about the at-home testing. And I appreciate people's patience as the protocols change, almost on a weekly basis sometimes. And nobody was happy about the previous version of the protocols, I'll tell you that.
Thank you. Christine?
I have some questions from parents that I believe Eric has already answered, but you can verify that you agree with Eric's answer.
Let's hope they're the same.
Yes, so is, excuse me, is the new process the same for vaccinated and for unvaccinated families? And Eric said it was yes.
I think I just said the same thing.
Yeah. The next question was, do you have to test on Mondays if the whole family is vaccinated? And
Again, the
answer
way
is
the state has proposed this program,
right.
again, I'm going to keep in mind, I'm not going around to people's houses to check up on them.
Correct.
The state has proposed a program where schools ask their families to test on the same day. So that's what we're doing. We're following the spirit of this program.
The next question is, what happens if you do not opt in?
Then you don't get the test at home, and you keep your kid home if you're sick. There's no difference. There's no
penalty. You just don't get the tests.
You don't get the test at home. Yeah.
Okay. I think that covered it, unless I missed
And
something.
all that's great. I just want to make sure that everyone realizes that that's for school, and we're extending that to now after school. We just mentioned that. If there's a positive in your house and your child is unvaccinated, then that's then you have to follow the CDC guidelines. Now, we may never know, but what the CDC is saying at that point, then your child would need to quarantine. But again, that's only for home. That has nothing to do with what we are doing. That's the CDC. So I just want to sort of mention that. So in order for us to participate in this, we have to commit to symptomatic testing. So if there's a child who is sick in school or gets sick in school, we have to test that child. We will probably send that child home. But a commitment to symptomatic testing is what allows us to participate in this program.
I just want to add, the comment you had made when you have someone test positive at home and the rules, that applies at work too for me. So it's not just something schools are doing. I just want to make sure people understand that's something that's across the board.
Patrick?
Sorry, one more thing. Around the cases in the house, I mean, that's one thing we've seen. When somebody in the house gets it, it usually spreads. So the way, again, talking to Susan Luminello, not speaking with her, but back in the days where we had 1 or 2 cases a week, the way it would work is if you lived in the same house, and I think some people here on our staff went through this. Once it hit your house, your quarantine didn't start until that person was out of isolation.
Exactly.
So, like, if Eric and I are roommates and I have COVID, like back in the old days, it was like I was in isolation for 10 days. He couldn't start his quarantine till after that, like if we were in the same place. So the reason I'm saying this, because this is where it gets, I don't want parents to get angry. Whatever they can do, if there's a case in their house, and I know with small children, some of this is out the window about, we're going to send our first grader off away from everybody. That's not reality. But if you have depending on the age of the individuals involved in the home who have COVID, if you can isolate the positive person from everyone else, like that's kind of the guideline, then that if there's a student in the house, they can come back. But if you're interacting with just asking again, with somebody that's positive. Again, that's the way the CDC guideline reads. If there's questions about somebody being asked to stay home longer, it's going to probably be because of a household case. So we're happy to take calls, but I just want to encourage whatever you can do if you have a case in the house to isolate the individual as much as possible so it doesn't stop other kids from being able to come to school longer.
Just one. And the only positives that need to be reported to the, only positives need to be reported to the school, not negative tests.
Yeah, we have enough to keep track of. Just
Yes.
if it's positive, let us know. And so that's another, I'm glad you asked that question too. And what we're going to do, what we have to do to the state on a weekly basis is report our numbers. So I would say we had 20 cases at Fox Hill, 15 students and 5 staff. We don't give names. So just so parents know, like, we're just tallying the numbers of positives. I'm not saying Johnny Smith to the state. It's not going anywhere. We're just giving our numbers to the state. That's what they're asking us to do, just to be clear on that. And that's why it's an opt-in versus a consent. The CIC system was a consent form because names were being shared outside of our district when positives came up. This is just an opt-in because we're not sharing personal information from our students or staff when positive cases come up. So I'm glad you asked that question.
And if I understand correctly, the only way it would be known if there's a positive test in the house is if it's self-reported? All right. Anything further with respect to the COVID update? Any questions or other comments? Anybody out there? See any hands, Bob? Okay. All right, thank you, Patrick. Under Facilities and Finance, Burlington High School, standing agenda item. Anything new, Bob?
Only news since the prior meeting through the chair is that I have had a updated meeting. We are finalizing the draft, so that should be coming soon. We have sent out the draft to the estimators. The estimators was part of that bid project. They are a third-party company working with the engineers. So that is the one piece that we're waiting for. Once we get that back, we can actually get it back in 2 parts like we talked about prior to. We can get the finalized draft back and share that, but we do expect probably another week to 2 on the estimations for the project. So again, I think we're wrapping up pretty quickly. We're waiting, like I said, just to finalize the details and then get the estimations, and then we'll present that to the committee.
Thank you. Questions? Thanks, Bob.
Excuse me. I thought that there was more information. Was that something that you shared at our meeting last week, or was it at the school building committee meeting that you shared that?
It's not more information. It's part of the draft report that will be shared with the full committee.
Okay.
At the SBC committee, I think you're referring to a comment that I made in regards to, I was under the pretense that the 30-30 rule applied to the full evaluation of the building and the property, which for the high school is
Okay.
assessed at $49 million. That 30-30 rule applies to the building envelope itself.
Okay.
The land does not come into that evaluation. That being said, that puts that 30-30 rule and the building assessed at about 25 million. Rounding it up, let's call it 25 million. 30% of that is just over $8 million. So there's a very, very highly strong chance, almost 100% chance that we are going to hit that 30-30 rule. That being said, some more information that came out in the study that I did discuss with the engineers is there are some opportunities where we could apply to the state for waivers. We'll have to obviously explore those opportunities later on, and I can get into details if need be tonight, but there are some things that are just outside of the scale of a typical project that would really just skew the finances. Something like fixing 3 elevators or the ramps here. So that is something potentially that we could apply to the state for a waiver, and if the state agreed, we wouldn't have to pursue as part of the construction project.
And I know you did say this tonight, but I was writing something else down, and you're still in the draft versions of the programs, and now that draft has been sent to another professional who's going to give us estimates. Is that accurate?
It is, but
But,
when we put out to bid,
yeah,
as part of the total project,
Right.
we were going to have these 3 companies and the 4th company who is the estimator.
yeah,
But the estimator was not going to do anything until the project was submitted to them.
yeah.
So we have gotten a draft. I have worked with the companies and the engineers on the drafts for any questions, finalize any details. We're at that finalized detail state now. So I'm waiting to get the finalized report, which would no longer be a draft. But that has also been sent to the estimators
Okay.
already. I was told as of, today is Tuesday, so last week on Wednesday, I was told that it is a 2 to 3 week turnaround time, as of Wednesday, last week. And of course, I pushed to see if we can get that quicker, if we can make that a 1 to 2 week. No promises, but that's what I
Way
was
to
told.
go.
So I expect in a future meeting that we will have a finalized report with estimations on the BHS feasibility study that we requested months ago.
Thank you.
Thanks, Bob. Next item, Fox Hill School Building Committee, standing agenda item. Dr. Conte.
Thank you, Mr. Chair. And you can actually be part of this update as well, because I think we had a couple conversations.
Oh, good.
I think we spoke with leadership from the MSBA, Mary Piketty, Jack McCarthy, and I think there was one more person, and I'm blanking on her name. Mary really does all the detail work. Jack, again, runs the agency, and we just asked some general questions, and I think they're really looking to work with us. I think the advice that Jack gave is just to continue to go through the enrollment conversations, continue to update the information, continue to educate his staff about the programming needs that we have. And I do think one thing they committed to, which I was very happy about, is, again, what he said is a bird in hand. Again, stay in the grant program, and when we move on to feasibility, which is the next phase, that they will present both options. I thought after our first conversation, they were only going to present a consolidated option, but they committed to sort of looking at both and presenting both. And that might mean there's a smaller school. It might mean a bunch of other things, but that might give us some options to look ahead to with the committee. And so I think that was the positive part of the conversation. I think the more challenging part of our conversation is they also said every year is new, and they can't connect the high school project to the elementary project. They're separate. They did say our community is very fortunate to have had 3 projects in the grant process over 14 years. They said many communities can't say that, again, in the new process, not in how the process used to work, but under the new formula. So again, I think they recognize the high school need is not going away. They have said the high school is a good project, but if they don't have the funding and there are other folks who have greater need based on their rubric, then the high school will drop off. So again, I think he must have said 4 or 5 times, Mr. Murphy, work with us, stay in the grant program. It's 7 years away. It's not next week. If situations on the ground change, we'll be reasonable. If you guys are reasonable, because we kept asking, what if this? What if the enrollment projection is wrong? And again, I think they want to work with us. So, Mr. Murphy,
Yeah, no, I
impression.
would agree with that summation. The biggest thing that I got out, well, 2 things that I got out of it. One was they certainly didn't give any indication, or they weren't even hinting that the high school approval was right around the corner. And the point that he was essentially making is if we walked away from the Fox Hill grant right now, there's no guarantee that we're going to get the high school, and so then we'd be out everything. So his advice certainly, as Eric just said, was to stay with it. I think from a context standpoint, and everybody's thinking, okay, we're starting to talk about this now, they're gonna build a school next year maybe or something. It's a 7-year process. It's gonna be a 2-year feasibility study phase. And, you know, we could get a year and a half into the feasibility study, and our enrollment figures are going an entirely different direction than what they've projected. And the point being, there's still plenty of time between now and when the shovel's gonna hit the ground as to what kind of a building we're gonna build, how big it is, who it's gonna house. So, you know, I know there was discussion at the Fox Hill Building Committee meeting, and there was, you know, a lot of dissatisfaction with the appearance that they were gonna make us just build one relatively small building and redistrict the whole town to try to fit everybody in. And Mr. McCarthy's point was essentially that their enrollment criteria per classroom that's what they do. There's nothing they're gonna do about that. But there was a lot of the variables that go into it in terms of where we are now, and where we're gonna be in 5, 6, 7 years. So, so I would agree with what Eric said, and I think it's probably the wise course, at least for now, is to stay with the program, continue through the current phase of the MSBA. They voted to extend us 30 days on the 270-day date. That's going to push us into sometime into March. We still have our warrant article on the town meeting agenda in February now. So our main requirement by the 270-day date was to have the money appropriated for the first phase. I think it's 1.5 million is what our warrant article is for. So we're still on track for that. In my opinion, I think anyway, that we should continue to move forward down that road. And, you know, a lot could happen between now and Eric mentioned the feasibility study. We'll look at a 1-building solution and a 2-building solution. So they're not taking that off the table. So I think we should stick with it, is my personal opinion. Obviously, we can all talk about it. We still have to meet with the building committee to get their input on it as well. And we have an extra 30 days to get those types of discussions on the table. But my takeaway from the meeting with the MSBA folk was to hang in there. They'll be reasonable, and it's not as cloudy a picture as I think we first got a week or two ago when we got the first news. So that's kind of where it's at. Questions, comments?
So by the delay that we requested, and I assume it was approved, or is that not happened yet?
They told us we would get it. All we had to do was ask for it, and Bob sent in the email, so.
So Bob, does that push us far enough into the future that we'll know whether or not the high school is even possible?
No. The 30 days, so basically what happens is the feasibility study, we were entered into July 1 of 2021. I'm sorry, the eligibility phase 1, July 1 of 2021.
Right.
270 days brings us up to February 26th. With the town meeting being moved, and also the fact that the MSBA's board meeting was moved into March, we weren't going to have the funding and or be able to have both meetings prior to. So we need the 30 days extension to not only get to our next meeting to review the new data for enrollment and possibly the 1 and 2 building projects, but we still need to get to town meeting for approval on the warrant article before we go to the MSBA's board meeting. So that 30 days is just going to give us that. The
All right.
MSBA for the high school
Yeah.
for 2021, they said it's not going to come out until April. That is their
Okay.
estimated date, but they didn't give us an official date in April.
Okay, when we took that vote at the building committee meeting, I was under the impression it brought us forward enough to know whether or not the high school would be approved, but that isn't working out, correct?
No, Ms. Monaco, that was my mistake. I didn't realize they said the maximum extension we could get sort of through their bylaws or regulation was 30 days. So
Martha?
I just wanted to maybe take this opportunity to talk a little bit about our warrant article. to town meeting, there was, confusion because we had 2 articles. And I want to state first that we have withdrawn Article 12. The school building committee and the school committee voted to do that. There's 1 article, and there have been questions about why it's $1.5 million. And it was something that Mr. Cuna did research. He came up with what he felt was a realistic number, and the MSBA said that it had to be this. This is actually more than what Mr. Cuna had thought might be an appropriate number. But this vote in town meeting is to allow us to move forward with the MSBA in this Fox Hill project. And without the vote, we won't get anything from MSBA. And the vote is for $1.5 million to do what the MSBA requires us to call a feasibility study. But one of our local engineers, Mr. Ernie Zabalotny, has pointed out that what it actually entails, the scope and sequence of it, is better described as a preliminary design and engineering cost study. So again, we're going to be sending out additional information for town meeting members, another backup sheet that hopefully will be clearer. Mr. Cuna has already gathered a lot of data that's been sent out to town meeting members. This new information, I hope will explain, this is a project that we all have agreed that is needed. We need to replace the Fox Hill, and the number for this requirement is to hire basically a project manager, and I don't know all the details, but we need somebody to manage this process, and any construction project needs this kind of a project manager, and with MSBA, there are specific requirements for how to do it. So I just, for anybody who's listening to this meeting, who's interested in the town meeting warrant article, number 11, that's just a brief summary. And if people have questions, to please call us and make sure that we can answer your questions. I want to give Mr. Cuna a chance to correct if I made any errors in that brief report. Is there anything I said that's not accurate? No. Okay. I'm getting a no from him. So I just want to encourage people to understand that this discussion about the Fox Hill School is a long-term process, and it involves doing this study that we will have to pay for, but the MSBA won't allow us to stay in their program if town meeting does not approve this amount of money, the $1.5 million. That allows us to stay in the program. If it doesn't all get spent, it won't get spent on that. So it will, is that accurate also, Mr. Cuna? How does that work?
Because this is a multi-year process,
Right.
again, through the chair, because this is a multi-year process, the OPM that we will have to go out to bid and ultimately hire at some point will stay on through the feasibility study, stay on through the design process, stay on through the building, and stay on through the completion of the project. So any fees not spent during just the feasibility or the hiring can be rolled into future expenses through the MSBA process.
For this project. Great. Thank you.
Any other questions or comments? One other thing I just wanted to add, we are continuing to work with the MSBA people on our classroom count, if you will. I know Bob updated them with some information in the last week or two. I believe they're digesting that and factoring it in, and we'll probably have a follow-up meeting with them, I guess, at some point to discuss that. But there still might be some wiggle room in terms of the size of the building that they would agree to, as far as that goes too. So that's also an open-ended question at this stage of the game. Chris.
Just a quick comment. I get nervous with MSBA and the enrollment numbers because when we built the new memorial school, when we were able to open it, it was already full. So I agree with the direction that the superintendent and the chair are going in, but I remain concerned that I wish we could have more space that they were willing to help us with.
And we may. It's a moving target. Like I said, it's a 2-year feasibility study. If the enrollment figures are clearly going in a different direction than what they had predicted, we have time to adjust those. And Mr. McCarthy said, obviously, as circumstances change, procedures will change. If there's nothing further on this item, I will move on to the BSAA stipend cleanup. Dr. Conte.
Thank you, Mr. Chair. Again, in your packet, we started this conversation actually in the winter of 2019, and I think I've lost 2 years of my life since then. We were supposed to have a follow-up meeting and a vote, and Nicole was going through the minutes, and I think once COVID hit, we never finished. So she needed me to do this. So
Through the chair, if I could ask you to say the words what BSAA stands for, that would be great.
it's one of our units that we bargain with. It's the Burlington Schools Administrators Association.
Thank you.
So again, this was just cleaning up one of the negotiations where we changed some of the stipends associated with that contract. And we need an official vote just to put it in the record. And again, we had mentioned this 2 years ago, but just the vote never came. So we have stipends for the BSAA homeschooling coordinator at $1,250 and a scheduling coordinator at $5,000. These stipends were approved for 1 year during the December 11th, 2019 school committee meeting, and these stipends were supposed to be addressed again at a later meeting. We made an adjustment to the contract and never had that second meeting. It's recommended the school committee approve the BSAA Burlington Schools Administrative Association homeschooling coordinator stipend at $1,250 and the scheduling coordinator stipend for $5,000.
So moved.
Moved and
Second.
seconded. Any discussion on the motion? Seeing none, put that to a vote. All in favor say aye.
Aye.
Opposed? That passes unanimously.
I have a question.
Sure.
Is this something that is an ongoing, are these two ongoing stipends now in that contract? Ongoing? Okay.
Yes, Ms. Sun.
Thank you.
All right, Dr. Conte, anything else that we need to address?
Just, I think it happened right before the meeting or right at the beginning part of the meeting. I believe, very importantly, David Ortiz was voted into the Hall of Fame. So
We don't have to take any formal action on that?
no, I think they voted without us.
Okay. Chris?
Dr. Conte, I have a couple of questions. First one is for some parents. Will there be a prom?
Again, I think I saw an email that Mr. Sullivan had shared with a parent. There is a prom scheduled. It's scheduled for the Danvers Port Yacht Club.
Excellent.
And so that would be for juniors and seniors. They will be bound by the rules of either the town of Danvers, the Danvers Port Yacht Club itself. So even if we have a mask waiver, for instance, and Danvers Port Yacht Club requires masks, just like if we were to attend dinner in New York or a theater, we would need to follow their rules. So again,
But we don't know their rules right now.
no, I don't know them right
Right.
now. But again, I know the prom is scheduled, and I know they're working towards making it happen. All I'm saying is things have been changing so quickly. If there are any limitations, I think what Mr. Sullivan just wanted me to stress is that they would prioritize seniors first. So if there were any limitations on the number of people who could gather.
But as of now, it's a senior and junior prom.
As of now,
And it is scheduled.
and it is scheduled.
Okay, I have one other question. I wonder if we could ask for some sort of an overview of the equity curriculum when you have a chance to put it together, maybe in the not-too-distant future. Parents would like to have an idea of what the curriculum would be like.
Can I, through the chair?
Patrick?
What do you mean? Can you say more? I don't know what an equity curriculum is.
Yes, so I think that with the much-needed equity position that we filled, and we're, I think, looking at the curriculum guidelines from the state, and parents would just like to have an idea of what is planned for introducing anything new that might not already be in the system, the current guidelines, current curriculum guidelines. We'd just like to have an overview, and so I thought I would just bring that to your attention.
Yeah.
Nothing specific, just an overview of where we're going with this.
I mean, again, it's a difficult question to answer without specifics. Generalities just cause confusion in my mind. I think we have coaches that are constantly trying model lessons that haven't, but they all fall within the curriculum frameworks. So if there's a specific question, like, we highly encourage parents to call the teacher, the principal, if they have a question about a lesson, and if it was in the frameworks or something that was out of context for them, we welcome that. But generalities are not really helpful in these types of discussions because they tend to just cause confusion.
Well, I'm not trying to cause confusion, I'm just trying to express an interest in an overview of what's coming.
If there's specific questions, we're happy to answer them, and we definitely, I know we'll talk about the equity work we're doing in the district. Equity work overlays every curriculum area, that's why it's confusing to me.
Yes, and I think that's what I was going to say as well, is that it's really built into everything. I do think we'll have opportunities, as we have in the past, to have some curriculum nights where we had to stop doing that. So I know prior to COVID, we would have a math night or something like that where we can talk about some of that stuff. So, Ms. Monaco, I don't, again, have a plan right now, but I think I understand what you're getting at, and you know, I certainly think we can talk about it, but I want to make sure if parents have any issue, they can certainly talk to their teacher. We trust our teachers to sort of create curriculum that's aligned with the standards and to move forward. But I do think we can discuss what it is, what our curriculum is. And again, it should really be built on a foundation of equity anyway. So I think we can put some summaries together for you.
Yeah, I mean, the reaction, I'm not asking for anything major, I'm just asking for a general overview of where we're going.
Okay.
Specifically with probably social studies curriculum, what changes there might be coming up that you are looking at.
Okay.
I took the time to study the elementary social studies curriculum, and I would just like to have it follow through with that we just have an idea, just an overview.
Okay.
Thank you. Anything further? If there isn't anything, seeing nothing, Chair will entertain a motion to adjourn.
So moved.
Second.
Moved and seconded, all in favor?
Aye.
Aye.
Passes unanimously, and we are adjourned.